And welcome back. It's time to talk about what's going around. Each week we bring in local medical providers to find out what kinds of issues they're seeing in patients lately. We have Minute Clinic nurse practitioner Bettina Johnson with us today, and we're talking about strep throat, something that you wouldn't think we'd be seeing in September.
Right. Well, with everyone coming back to school these days and kids sharing, pencils and coughing and sneezing and not washing their hands, they're more likely to get exposed to that bacteria that can cause strep throat. So
what are some of those symptoms to look for kids, adults, and even parents?
Strep throat is really common in children ages 3 to 15, also through adulthood, but usually those are going to be affected through or affecting adults that have small children. But symptoms you're going to see are high fever, really bad sore throat, maybe even some nausea and a stomach ache, a headache, and just probably one of the worst sore throats you'll experience. So
yeah, never a good feeling when you can't even talk, or it's hard to breathe.
Right.
Too.
Sometimes you can get really swollen tonsils because it can affect your tonsils and the back of your throat. Sometimes people will have a little bit of a runny nose and a cough with their sore throat, and they'll come in and thinking that they have strep throat. But usually when you have symptoms like postnasal drainage or a cough, we're not looking for strep. It's rare to see those things happening together.
And if you think you have symptoms of strep throat, it would be good to go in and get the test done.
Yes.
There's a specific test.
Have your throat swabbed, and that way we can detect if the bacteria is in the back of your throat. And if it is, then it needs to be treated with antibiotics. And you also need to get rid of your old toothbrush after you've been on antibiotics for at least 24 hours, so you don't reinfect yourself with your toothbrush later.
Yeah, that makes sense. It's something that I haven't even thought about.
Yes.
And if you don't get the proper treatment, what are the consequences to that?
So strep throat can have some complications when it goes untreated, such as rheumatic fever, which can cause joint inflammation and swelling, as well as damage to some of your heart valves. Also, scarlet fever is a rash that we see. So sometimes children will present to the clinic with a rash, and it's actually strep throat that we need to treat, not the rash. So really important to make sure that you have a really bad sore throat, you're getting that evaluated by a healthcare provider.
Yeah, absolutely great tips, especially if you're starting to see it pop up already. So we appreciate all the information, and thank you for being here with us today on What's Going Around.
Thank you.
Yeah.